Hey guys, today we're going to talk about the actual blood flow through the heart. And remember, this is the pump function of the heart. The heart pumps the blood throughout the body, and I'm going to teach you how the blood flows through the heart. Now, please note, I do realize this is not the anatomical correct version of the heart, but this is a way that we are going to learn it, and then we can apply it to the anatomically correct heart, okay? So, we have our blood, and the blood, our blood carries oxygen, and it is actually going to deliver that oxygen to our different organs and tissues so that everything can be oxygenated within our body. When that blood has done that, it comes back in through the right side of our heart. Now remember, it's always the patient's right and left. So this is would be the patient's right side of the heart, and the blood is deoxygenated because it has dumped that oxygen to wherever it's been, and it's coming back into the heart. Now this is going to enter through the inferior or superior vena cava. Vena cava is just a fancy word for vein. Okay, and these are really big veins. Now, if it's superior, that means it's coming from above the heart. That deoxygenated blood is coming from above the heart. And if it is inferior, that means it's coming from below the heart. So it enters into the right atrium. Now, there are 4 chambers in our heart, or 4 rooms, like when I'm explaining to a patient, that's how I would explain it to them, and it's coming through the right atrium. That's the first stop. Of course, that's in the first chamber of the heart. So we have deoxygenated blood, and it's coming through. Well, now to enter the next chamber, it has to go through a tricuspid valve, which is like a door, basically. It regulates when this is open and when this is closed. So it comes through there, it goes through the tricuspid valve. Now, one way I remember that the tricuspid is on the right side is if you try, you're always right, okay? So you have the deoxygenated blood that comes through from the inferior superior vena cava. It goes through the right atrium, it goes through the tricuspid valve, and then it goes into the right ventricle. It is still deoxygenated. Once it's in the right ventricle, it goes out through the pulmonic valve and the pulmonary artery. Okay, so there's a valve. Now, arteries always carry blood away from the heart. That's how we remember it. Veins bring it to the heart, arteries carry it away. And arteries always have a valve because we have to have that door to get out. Okay, so we have to go through the pulmonic valve, the pulmonary artery, into the lungs. We have 2 lungs. Here, the blood is now goes from deoxygenated to oxygenated. So when it enters the left side of the heart, it is now oxygenated. Okay, so it's oxygenated, and we enter through the pulmonary vein because we know we enter the heart through veins. So we enter through the pulmonary vein into the left atrium. The difference is we are now oxygenated, okay? Now it comes through. We have to get to the next chamber, which is the left ventricle, but we go through the bicuspid or the mitral valve. You need to know both, okay? You have to know both names. I don't know why we have 2 names for them, but we do. Okay, so I remember if you try, you're always right, and then BM, that's how I've always remembered it since nursing school, is bicuspid or mitral. So this valve controls, and it comes on down to the left ventricle. Now, we have to get out of the left ventricle, and so we go through the aortic valve, which is just like a door, and then through the aorta. The aorta is a huge artery, and we know arteries carry blood away from the heart. So now the blood comes out, it's oxygenated, and it goes to all the body. The liver, the big toe, the brain, it goes to all the places to oxygenate. Once it dumps that oxygen, it cycles back, and it comes back because it's deoxygenated, and we do this, y'all. This is the pump. It pumps the blood through the heart in this particular order. Now, this happens 60 to 100 times a minute for a normal heart rate. That's amazing. So everything has to work just perfect. So these are valves, are like doors. So when the left and right atrium are relaxed, okay, so they're relaxed so they can fill with this deoxygenated blood and the oxygenated blood, these valves close, okay? These valves close so that it can fill. While these are relaxed and filling with blood, the right and left ventricle contract. They squeeze that blood out, and both of these valves, the pulmonic and the aortic valve, open, and the blood empties out. The oxygenated blood empties out of the left ventricle to the body. The deoxygenated blood empties out of the right ventricles to the lungs. Now what happens are these valves close. The right and left ventricle relax so that it can open up to receive blood. The right atrium and the left atrium contract, so they squeeze. these valves, the tricuspid and the bicuspid, open, and the blood enters into the relaxed right ventricle and left ventricle, and these valves close. That is what you hear when you hear la, dup, in the heart rate. That's what's happening, guys. Now, that is if the heart is working perfectly. But we know that doesn't always happen because we take care of really sick patients. But if you understand the why and the how the pump works, then we can understand when the pump fails. For instance, when you have a left-sided heart failure, that means the left side, typically the left ventricle, has failed and it's not really pumping out blood like it should. So think about this for a moment. If the left ventricle is supposed to contract like this, but it's only contracting like this, it's not fully emptying, right? It can't pump out enough blood. So what are signs of left-sided heart failure? Well, eventually that blood's all going to back up into the left ventricle. Then it's going to back up into the left atrium. And eventually it's going to spill back and back up into both of the lungs. So what are some signs we might see? Well, that's where you're going to see the pink frothy sputum because we've got blood in our lungs, right? The patient may feel like they're drowning. They're going to sound real wet and they may need to be on oxygen. They're going to be short of breath because we've got all this extra blood backing up into the lungs, and that shouldn't be. That would be left-sided heart failure. Right-sided heart failure, same thing happens. This is not pumping effectively to squeeze all the blood out so it can refill. So if it's just barely pumping, I'm not getting rid of all the blood, and it will eventually back up. Where does it back up? Well, it backs up into the body. Now, we know gravity works, and so the blood will go down to the legs, and that's where we will see edema in the legs, or you can also see the veins distended in the neck. Okay, so that's just one example of how, if you understand how the blood flows through the heart and the pump works, you can understand when it messes up. All right, guys, make sure you review this and make sure you understand how the blood flows through the heart. You can do this. And remember, knowledge is power, and this is really cool to know how this works.